Welcome to Clear Minds. Nearly 29 million Americans are living with a diagnosable alcohol use disorder, yet more than 92% of them will never get any kind of help. That's a group of people larger than the entire population of Florida. It's a silent epidemic that contributes to over 140,000 deaths every single year, making it the third leading preventable cause of death in the United States. So, what's actually going on here? Why is it a treatable medical condition being ignored on such a massive, tragic scale? In this video, we're going to break down the powerful, often hidden reasons our system is failing millions and what can be done about it. But before we get into that, let's make this personal. Think about someone you know. It could be a friend, family member, or even yourself. They're successful. They have a good job, a loving family. But behind the scenes, there's a struggle. They drink more than they want to, make promises to cut back that they can't keep, and live with the quiet fear that someone will find out. Their doctor might ask, "So, how many drinks do you have a week?" And they'll answer, "Oh, just a few socially," because the shame is just too much. They consider getting help, but the thought alone is terrifying. What will people think? Will I lose my job? Am I really an alcoholic? This internal battle, this cycle of shame and fear, is where the treatment gap begins. This is a story playing out in millions of homes across the country, hidden in plain sight. The single biggest barrier that keeps people from getting help is stigma. For decades, we've treated alcohol use disorder, or AUD, not as a sickness, but as a moral failing, a sign of weakness, or a simple lack of willpower. But the science is clear. AUD is a chronic, treatable medical condition, just like diabetes or heart disease. It's a disease that literally rewires the brain, and public perception still hasn't caught up. One study found that addiction is more stigmatized than almost any other health condition. People are afraid to ask for help because they worry about losing their jobs, what their friends will say, or just being labeled an alcoholic. This fear is so powerful that many people try to handle it completely on their own, convinced they should be strong enough to fix it. This self-stigma, the shame that people internalize, creates a devastating barrier. It convinces them that they are fundamentally flawed, which leads to what some researchers call the feeling why try effect, the feeling that there's no point in even trying to get better. You'd think the doctor's office would be the one safe place to turn, but our healthcare system itself is a huge part of this problem. Most doctors get surprisingly little training in how to diagnose and treat substance use disorders. Think about it. Your doctor probably weighs you and takes your blood pressure at every single visit, but how often do they screen for unhealthy alcohol use in a serious, non-judgmental way? For a lot of people, the answer is never. The gap in training and screening means that even when a patient is ready to talk, many primary care doctors just don't know what to do next. There are multiple FDA-approved medications and evidence-based therapies proven to help people cut back or stop drinking, but they are massively underused. Instead of being treated like a manageable chronic condition, AUD is often only dealt with when it hits a crisis point, like a trip to the ER. This reactive approach, instead of proactive care, leads millions struggling until their health completely falls apart. Even for the few who overcome the stigma or get proper diagnosis, the path to treatment is full of roadblocks. Cost is a massive one. Many people don't have the insurance coverage to pay for their therapy or rehab, and the out-of-pocket costs can be crushing. Beyond money, there are logistical barriers. If you live in a rural area, there might not be any treatment centers nearby. If you're a single parent, a lack of childcare can make it impossible to attend appointments or enter a program. And finally, we have to face a difficult truth. Our society normalizes and even encourages heavy drinking. Alcohol is tied to everything from celebration and relaxation to professional networking. This makes it incredibly hard for people to see when their own drinking has crossed the line from social to problematic. When binge drinking is just a normal weekend activity, how is someone supposed to recognize their own behavior as a medical issue? This cultural wallpaper of alcohol makes it easy for people to stay in denial until it's too late. So, what's the path forward? It starts with understanding that alcohol use disorder is a medical condition, not a moral one. It's about demanding better training for our doctors and better access to treatments that are proven to work. There is hope. A growing number of people, especially in younger generations, are choosing to drink less and embrace a sober, curious lifestyle. Change is happening. If you or someone you know is struggling, please know you are not alone and that effective, compassionate help is available. We've included links in the description to resources like National Institute of Alcohol Abuse and Alcoholism and the Substance Abuse Mental Health Services Administration. Please consider sharing this video. By spreading this information, we can all help fight the stigma and begin to close this staggering treatment gap. Subscribe for more videos that break down the health issues that matter. Thank you for joining.